Today, I'm going to perform or demonstrate the Lentino method in a tangential carpal bridge in original method. Patient position, seated sideways or standing at the side of the table. Purpose and structure shown. This view should demonstrate the scaphoid fractures, calcification, lunate dislocation, presence of foreign bodies in dorsum's area of the wrist, and chip fractures of the dorsal surface of the carpal. Part of position, so it should be centered dorsal aspect of carpals to IR. The back of the hand should be in contact with the image receptor and perpendicular angle with the forearm. Central ray, 45-degree caudal angle, 1.5 inch cephalic of bend at wrist. Next is we have the Lentino method in a tangential carpal bridge in a modified method. The patient position, it should be seated or standing. Elevate forearm with sandbag. We use pillows. Wrist flex at right angle to the forearm. The IR in a vertical position against dorsal surface hand, and of course the shouldering. The central raise angle 45-degree caudal entering 1.5 inches proximal to wrist joint. Next is we have the Gaynor Hart method, carpal tunnel in tangential projection. Patient position, seated sideways at the end of the table. Place arm on the table with elbow bent. Ideally, upper arm and elbow and forearm are all resting on the table. Part of position, hyperextended the wrist, center the joint at the area of the radial styloid process to the mid portion of the image receptor. Make the long axis of the hand as vertical as possible without causing pain or discomfort. Slightly rotate the hand towards the radial side to prevent superimposition of the hametes and pisiform shadows. Hold the wrist in an extended position by having the patient or someone grasp the digits either by using the opposite hand or using a device. The central ray, 1 inch distal to the base of the third metacarpal at an angle of 25 to 30 degrees in reference to the long axis of the hand. Purpose and structure shown. This view is for identifying abnormalities of the tissues in the canal and fractures of hametes, trapezium, and pisiform bows, and soft tissues of the wrist. Next is we have the Marshall method, superior-inferior projection. Patient position, standing at edge of the table. Part of position, reach back and place fingers on the edge of the image receptor. Dorsiflex the wrist as much as tolerable and lean forward to position the carpal canal perpendicular to the image receptor at the image receptor. The central ray, tangential to carpal canal and directed at mid-carpal area and perpendicular to the image receptor or undulated towards the hand approximately 20 to 35 degrees from the forearm's long axis. Purpose and structure shown, an alternate method with similar result to the Gaynor-Hart method.